Welcome to American Black Journal. I'm your host, Stephen Henderson. April is National Minority Health Month, and that's a time to draw attention to the health disparities that affect minority communities and promote actions to improve health outcomes. My first guest is doing just that. Dr. Cleamon Moorer Jr. founded Eye Care for Detroit. Now, that's a nonprofit that's helping homebound and underserved residents get access to vision care. The organization operates the city's first walk-in eye care clinic and a mobile unit that services patients in their homes. I'd like to welcome Dr. Moorer to American Black Journal. Great to have you here.
Thank you, Stephen.
Yeah.
Pleasure to be here.
Yeah. So, when we think about healthcare and healthcare challenges, there's no question that in cities like Detroit, in the African-American community, they are more acute than they are in other places. But I'm not sure that we always are thinking about the total health picture, right? We're thinking about access to primary care in most instances. But eye care is just as important.
Yes, it is.
Talk about the work that you're doing to make sure that folks here have access to good eye care.
Absolutely, Stephen. Thank you. So it seems that vision care is often back burner in a lot of people's healthcare journey, where a person has a reaction to a comorbidity. Blood pressure is a little high, my numbers have exceeded their thresholds, and now my vision is blurry. What should I do, right? So we want to educate and engage the local community in the importance of vision care so that it's not reactive, but more so proactive, similar to, children starting their first day at school.
Right.
Let's get out and talk with seniors.
Yeah.
Yes.
How important is that early eye care, to children, to young people as they get, older into adulthood?
Stephen, it means everything.
Yeah.
Our optometrists and ophthalmologists tell us that if we can detect glaucoma early on, if we could detect early signs of cataracts or macular degeneration, the advancement of those diseases in many cases could be cut off.
Can be slowed.
Yes, absolutely.
Yeah.
Sure.
The problems that we have getting people access to eye care, are they kind of part and parcel with regular healthcare access, or are there other barriers that also play a role in this one?
There's other barriers, Stephen.
Okay.
So there is a shortage of eye care professionals within the city of Detroit.
Right.
So if you look at the ratio of one eye care professional for every 15,000 to 20,000 Detroiters versus some of our counterparts in Kent County and Oakland County around the state of Michigan that have a 1 to 1,200 or 1 to 1,500.
Wow. I mean,
ratio.
it's a dramatic difference.
Absolutely. Yes, it is. So, but there are a lot of retail venues that sell fashionable eyewear.
Right. Which is not the same thing as going to see the eye doctor.
No, one of our mottos, Stephen, is we definitely care how people look, but more importantly, we care how people see.
How you see.
Come on. So let's dive deeper. Let's dive deeper and analyze and see if we could diagnose and prevent the progression of eye health disease.
Yeah. What do you do about that? How do we attack that problem of, the availability of eye care?
Well, mobilizing it has been our solution,
right.
Where we understand that due to transportation barriers, lack of access, not knowing where to go, cost, expense, and then, of course, the sandwich generation, the working adult that needs to take an elderly parent to an eye care appointment turns into an all-day affair.
Yeah.
So we've looked to streamline that process by developing a mobile outfit to go to patients' homes, to go out there in the senior community and cut that gap.
Yeah. Is that a long-term fix?
I do believe so.
Yeah.
In the event that we can engage more ophthalmology students from local colleges and universities, as well as optometry students into the field to create clinical-based field experiences under licensed optometrists and ophthalmologists.
Yeah.
Certainly.
Yeah. Talk about what you're seeing when you're going to, I assume, like senior centers in some cases, or just say patients' homes. How how much is there a gap, I guess, in the care that people were getting?
Stephen, we are seeing stickier cataracts, for lack of a better phrase, where a person has advanced blindness, legal blindness, due to their cataracts not being removed.
Okay.
We're seeing mac degeneration to an extent where a person has lost all of their peripheral vision, and it's just extremely
You can see straightforward.
absolutely very myopic, and not being able to see what's in front of them,
Yeah.
but necessarily what is around them.
Yeah. Obviously, for conditions like that, it's not just the initial visit, but long-term care.
Long-term care, and also getting to the loved one or caregiver within that household or community to also try to address vision health or vision care issues.
Yeah, right. I mean, you go to see one person, but you've got a family.
It's a family affair.
And everybody needs good eye care.
Yes, indeed.
Yeah. So I want to have you talk also about your own personal story, which is really inspiring, and is how you come to this space.
Stephen, my own personal journey inspired my work. I was born with congenital cataracts, which is rare. However, the cataracts progressed throughout the years. So growing up in the 80s and into the 90s, my vision progressively got worse. So by the age of 20, going on 21, hey, I was legally blind.
Wow.
Yes.
So talk about what that was like. I mean, as a child, how you get to that point.
So imagine, Stephen, a glass of water that has an eyedropper that drops droplets of milk into that glass. Over time, with more droplets of milk, the water is cloudy, and you're trying to look through a cloudy or opaque vision of whatever is in front of you or around you. So it progressively got worse.
Yeah. And you were not able to get care.
No.
What was the reason for that?
My parents had a small business on Livernois, C&M Collision, bump and paint, which Detroit and Livernois is
lots of businesses like that.
That's right. And the small business owner's insurance plan they had
didn't cover eye care.
Did not cover eye care, let alone a eye care surgery.
Really?
Yeah. So
how common is that people who have insurance don't get insurance?
So it really depends on how the insurance plan is structured.
Yeah.
So granted, if there is a medical issue or a diagnosis, an eye care professional can see that patient for that medical diagnosis. If it's not medical per se and it's a vision plan,
I see.
It turns into an add-on.
It's an add-on to the regular health care.
Absolutely. So being a healthy kid, growing up, despite, some allergies here and there and poor vision, it didn't fall under medical.
Wow. So what was the solution that your parents found?
Oh, so my beloved mother, sought out different funding sources. She was blessed enough to find the Sinai Grace Guild at the time. She wrote a letter to the board, because I went to Sinai throughout the years. That's where my eye care professionals, my ophthalmologists were. And the board decided to cover the removal of my
cataracts. Wow.
Yes, they did. So forever grateful.
Yeah. And that is it that generosity that inspires your
it fuels it.
Your turn to that work?
It certainly fuels it, Stephen. I did promise her upon her passing that I would pay it forward and try to help as many Detroiters as possible.
Yeah. Yes. I mean, it also is a great lesson in the idea of things never really being too late. It's never too late to do something, right? You essentially had lost your vision at the age of 21.
Absolutely.
But today, you're able to treat other people.
There you go. That's it.
Because somebody intervened.
Totally, Stephen. So I think the combination of both sympathy and empathy, the sympathy of, I feel sorry for you, I understand, but empathy, I lived it. I know firsthand.
Been here.
Yes.
Yeah. How many people are you able to reach with the mobile?
Yeah, the goal is 40,000. Yeah. So we are taking on like 50 to 60 patients or homebound folks a week. But the aim is to get to all of Detroit's homebound community out there.
Yeah. And what's the financial support for this that closes that gap for folks who don't have insurance?
Billing, we typically try to bill for those that are insured.
Yeah.
But, Stephen, to answer that question, to cover the entire community, we've estimated a fee or a cost of $250 to $300 to get a person a comprehensive exam, a pair of eyeglasses, and referrals to specialists. So covering 40,000 Detroiters is a $10 million to $12 million undertaking.
Yeah.
It certainly is.
Somebody's got to step up and
somebody has to.
try to do that.
Yes, and we know that there's a generous philanthropic community within the state of Michigan as well as the country that could help us fit that bill.
Yeah. All right. Dr. Moorer, congratulations on the work, and thank you very much for being here.
My pleasure. Thank you for having me, Steve.